All right. Hi, everybody. Thanks for joining us today for WIHA's office hours on this snowy January 19th of 2023, the first office hours session of the new year. I'm Chris Krasnowski, Executive Director at the Wisconsin Institute for Healthy Aging. For those of you who don't know me, and we recognize always that there are often new folks coming aboard who may be new to their positions or be new program providers with WIHA. So for those of you who are new to office hours, this is kind of our time to talk with program providers about issues related to healthy aging, related to the programs that you're all providing, and sometimes, issues with other work that WIHA is doing, opportunities that WIHA has to augment some of the work that you're doing in your communities. So we're really glad that you're able to join us today. As you can see, the agenda, we'll be talking first about diabetes in Wisconsin and self-management interventions. Then we're going to move to an update on the Falls Free Wisconsin Center and effort that's going to be going on this year. And lastly, as is our tradition, WIHA program updates where you'll hear from other WIHA. But first, let's get ourselves warmed up on a chilly day. So music is good for you. This probably doesn't come as a great shock to a lot of people, but there are heart health benefits to listening to music, lowers your blood pressure, can elevate your mood, reduce stress, stimulates memories for people with memory loss. Music can really stimulate warm memories for folks. So in the chat, tell us what's your favorite either genre, artist, band, or if it's a song, tell us what's your favorite song. So you could say country music if that's your favorite, or you could tell us a specific singer, a band, or if there's a song you love, let us know. Jennifer Sackett is into the 70s and the Beatles. Classic. Oh, we got a lot of Beatles people. Some jazz, 80s rock, Wilson Phillips. Okay, these are flying in too fast. I'm trying to catch up. Johnny Cash and Ring of Fire. That's a great song. Absolutely. Lord Huron, Trampled by Turtles. Yeah. Eagles, some other oldies but goodies. Headley, a Canadian band that almost no one has heard of. So maybe next time we'll have to have Aaron produce a little audio file for us so we can hear Headley. That sounds awesome. Any others? Let's see. 80s British music with lots of black clothing and black makeup. That's me. I was into the alternative British music from the 80s. Let's see. Oh, Dana's into meditation music, also hip hop, probably not at the same time, I'm guessing. Bluegrass, electronic, like EDM maybe, a little bit of everything. Amanda's a Kelly Clarkson and 2000s pop fan. Puddles, Pity Party. I might have to ask a little bit more about that one. Have not heard of that one. Rob, do you want to unmute and tell us what Puddles Pity Party is?
It's a guy, Mike Greer, who he puts on this persona where he dresses up like a clown, but he just has an amazing voice.
Oh,
was he on America's Got Talent?
Yes, he was.
I remember him.
All right, I'm gonna have to look that up. Puddles Pity Party. All right, everybody, we have something fun to look for. Jeremy Camp, someone's favorite, love contemporary Christian music. Awesome. Great. That's great. Well, I'm glad there's so many music lovers there. And, if it helps to know that when you're listening to music, you're doing something good for yourself, that's great. So thanks for sharing that, everybody. So next we're going to move on today. As I said, we're going to talk about initially about diabetes and diabetes supports. So joining us today, thank you, Lena, is Lena Swander, who's an epidemiologist at the Chronic Disease Prevention Program in the Division of Public Health at DHS. And Lena is going to share with us some state level data on health behaviors that are also risk factors for diabetes. So with that, I'm going to stop sharing and hand it over to Lena.
Yeah, hey everybody, nice to see some familiar faces, a lot of new ones. I'm still laughing at that icebreaker. I accidentally ended up at a Clash cover band concert this past weekend, and I'd like to say that it did some good for my health, but I forgot hearing protection. So I think all in all, it probably on the negative side there. But yeah, so like Chris mentioned, I'm with the Department of Health Services Division of Public Health. And even further down the bureaucratic layers, I'm in the chronic disease prevention program. So we've worked with WIHA for a number of years, much longer than I've been employed here. I've been with our program for about 5 going on 6 years. So I do a lot of different data and surveillance stuff. So I'm going to be sharing some high level trends that we have been seeing, like Chris mentioned, for a lot of different health behaviors data. So most of what you're seeing for the next few minutes is going to be coming from surveys that are done every year across the state of Wisconsin for adults. We've got a few data points on high school age students too, but just kind of want to preface what I'm sharing. That's where a lot of the data is coming from. So yeah, but anything data related, sort of more authoritative stats on diabetes in Wisconsin or obesity rates, things like that, I'll share my contact information at the end of the presentation so you can get a sense. If you have any questions, just feel free to reach out to me after. So this is a presentation that was actually given. I'm not sure if any of you were able to attend or were aware of it, but our program put on a statewide convening back in December. And this is some data we put together for that convening, but I think just gives a nice, really high level overview of what we have going on in our state. So kind of open with a few key terms, talk about a few trends, and then we start to break down some of the data to look at socioeconomic status differences in different rates of conditions and behaviors, a little bit of place-based data, so sort of where you live matters, some race ethnicity disparities, age disparities, and then also looking at some sex differences in health behaviors and outcomes data. So some of the key terms that we just like to level set and have everybody be familiar with. Health equity is a big one. If you've attended any of our other department or division presentations or heard anything coming out from us lately, this is a really big focus for us, and we use this definition here. So health equity is achieved when everybody has the they can all attain their full health potential. No one's disadvantaged from achieving this potential because of social position or other socially determined circumstances. These are a couple of other key terms that are kind of popping up in different spaces. So just thought I'd share here. Priority populations. So I think in some of the some of the chronic disease prevention work that you are all working on, thinking about how do we really extend outreach to people who are at sort of greater risk for these conditions, or those that have greater obstacles to health. And oftentimes a lot of these differences are historically linked to discrimination or exclusion. So just trying to be very aware of those challenges. And then social vulnerability is another concept that will come up in one of the measures I'll talk about here, but it's really kind of this measure of the resilience of communities. And there's a lot of different ways to measure this, but one that we will take a look at in a second is kind of a big mishmash of poverty rates, lack of access to transportation, crowded housing, a lot of different things that kind of get at the social vulnerability of a community. So with those sort of things in mind, gonna look at some of the overall trends that we're seeing and some big key indicators of health that we tracked. So this is a map. You can see it's moving rapidly here. It's a time-lapse map, and it's out of a research group at Harvard. that we've worked with over the last year for some Wisconsin specific things, but they do a lot of other different research. And since about 1990, adult obesity rates, probably as many of you know, have been rising across the US. So most states were starting around 20 to 29% of adults with obesity. And then sort of as we move into the 2000s and 2010s here, almost every state is following the same shared trajectory of reaching 30 to almost 39% of adults, that orangish color. And then kind of where we land in future projections is that we are thinking about 50 to 59% of adults are going to be obese. So I think this model was done before COVID, and it was having Wisconsin sitting at about 50% of adults with obesity in the year 2030. So now we're starting to actually see this trend play out with our own local surveillance data in Wisconsin. So that was just a model, but we're seeing that both in our own data, the youth and adult obesity rates are also worsening. So in about 2019, 15% of Wisconsin high school students, that's that light blue line at the bottom, had obesity. Compared to back in 2001, it was about 10%. 2020 is the most recent data we have on Wisconsin adults. That's that dotted dark blue line. And you can see that that's sitting at about 32% of adults have obesity in Wisconsin, compared to about 28% back in 2011. So that is also increasing in our local surveillance data. This is a different measure, same sort of concept. We're looking at high school students and adults over time, but now we're looking at physical activity rates, and we're seeing that this trend is not significantly changing over time. Again, these are self-reported surveillance survey data, but just the most recent data suggests that, in fact, you can kind of see a little, almost like a downward trend. So there's some suggestion that both high school students and adults are participating less in physical activity. These are slightly different measures. The adults is looking at 150 minutes of aerobic activity per week. The high school students were looking at 60 plus minutes for 5 days in the last week. But all in all, sort of still the same trends here. Same concepts here, high school students and adults, just in different colored lines. Now we're looking at consumption of fruits on the left-hand side. So we're seeing that this is kind of a counterintuitive measure, but it's a measure of who's consuming fruits less than one time daily. So basically, we want to see this percentage on the left side of the screen decline. And you can see that it's actually trending upward with the most recent data for both high school students and adults. So people are consuming fruits at lower rates. The right side of the screen is high school students and adults consuming sugar sweetened beverages. So this is oh, was that a question? Or did I hear something? Maybe just some background noise. But also something that we're not seeing improving. Another measure of health behavior that we track. So now I'm going to change gears a little bit. We're looking here at, these are, again, still self-reported surveillance data from surveys in Wisconsin. We're looking at now adults who report that they're getting screened for high cholesterol. We've seen a slight uptick in that number since 2011, which is great. On the right-hand side, we're looking at adults taking their blood pressure medication if they have high blood pressure, and we're seeing that that number is declining, unfortunately. All right, maybe moving into the more topically related subject for today. diabetes and prediabetes. I know that this is a lot of your focus programming is focused on things like healthy living with diabetes and sort of dipping your toes into National Diabetes Prevention Program work. So these are the diagnosed diabetes and prediabetes rates in Wisconsin. We see that, they've been increasing since about 2008. And I guess I just wanted to point out with this measure too, the pre-diabetes measure here is simply just an awareness measure. So if we call somebody on the phone and ask them with the survey, have you ever been diagnosed with pre-diabetes? Many people who actually have the condition have not been diagnosed. So in some sense, we know that it's good that the pre-diabetes awareness rate is increasing. More people are talking with their healthcare providers and getting this type of information. But we still suspect that, about 8 or 9 in 10 adults in Wisconsin are still not aware that they have prediabetes. These are some other measures of adults. This is specific to adults with diabetes. Kind of a busy thing happening here on the left side of the screen, but the big takeaways are that adults with diabetes receiving foot exams, that's the green line, and then their A1C checks where there's a lot of variation in this measure, but we're not seeing a dramatic increase. It's kind of all over the board. And then eye exams, that's the blue line, where we're not seeing an dramatic increase in most recent years that we would say is meaningful with this measure. Kind of tricky measures since there's a lot of variation in them, but still just some food for thought that there's more people to reach. Almost, I almost didn't want to show this on the right-hand side, but this data is coming from ADA and ADCES accredited, so clinically accredited based DSMES programs. I know that, so I guess I just want to say this is not representing healthy living with diabetes or some of the other programs that I know WIHA and folks on the call are more involved in. But from the clinical perspective, what we're seeing is that encounters happening at the accredited and recognized clinically based programs are declining. There's a lot of different reasons for that. The accreditation and certification numbers are always fluctuating. So we're really only receiving data from those programs that maintain that status. But I think across the board, we kind of know that COVID really impacted access to DSMES in a clinical space. So did anticipate to see some of that decline in delays of care. National DPP program that some of you are probably all very familiar with. We're looking at here on the left side of the screen, the number of organizations. So we have seen significant growth since 2014 when we really started focusing on this program as a state. In the number of recognized organizations offering this program. So we're now sitting at about 46 CDC recognized organizations, which is amazing. And the Medicare DPP recognized organizations is also on the rise. So that's very exciting. And appreciate those of you that have been working on this. And, sort of to follow with that, the number of participants here on the right-hand side of the screen is also dramatically increasing. I think we're sitting close to now about 9,000 Wisconsin adults who have ever participated in national DPP. So this is the sort of the mid chunk of the presentation. I'm going to kind of breeze through some of this, but really wanted to highlight a few disparities, significant disparities that we have in Wisconsin in chronic disease. So what we're looking at here is sort of measures of socioeconomic status. So on the top hand part of the screen, we've got different income levels, household income levels, and then below that, we've got educational attainment status of adults in Wisconsin. And so probably not surprising to many of you that lower socioeconomic status is associated with less fruit and vegetable consumption. This again is kind of one of those counterintuitive consumption measures where it's that measuring that consuming less than one daily. And then when we take a look also at socioeconomic status with vegetable consumption, again, not super surprising, but we see large disparities exist within educational attainment. So 37% of those with less than high school education consume vegetables less than 1 time daily, compared to 16% of college graduates. Sort of the same idea here. We're looking at socioeconomic status by different conditions now. So lower socioeconomic status is associated with higher rates of diabetes. So what this is highlighting is that 14% of adults with a household income of less than 15,000 have diagnosed diabetes, compared to 6% of adults with $75,000 or more. And similar story with obesity rates, 38% of those with less than a high school education have obesity, compared to 26% of college graduates. We also know that lower socioeconomic status is associated with lower physical activity participation. So 42% of those with less than a high school education participate in 150 or more minutes of aerobic exercise per week, compared to 64% of college graduates. So pretty marked disparities in that measure of health behavior. Also want to talk quickly about some place-based disparities. So we know that place matters a lot. The places of, where we live, where we work, all have significant impacts on health and influence our experience with disease and well-being. We can look at a lot of different measures by place. I'm only highlighting one here. It's pretty impactful. So I think overall, measure-wise, we know that 78% of Wisconsin's total population has adequate access to locations for physical activity. I could dig into what that exactly means, but essentially it's access to things like parks, it's measuring access to YMCAs, to other public places that people can safely exercise. But what you're seeing on this map is that even though we have a lot of people in Wisconsin who do have access statewide, there's a lot of variation by place. So the darker blue means less access, and the lighter blue means more access. About half of Wisconsin counties, less than 52% of the population has adequate access. And you can see that a lot of that is happening sort of in the driftless region and in the northern region. So some of this has to do with urban access to locations to safely participate in physical activity. I think just wanted to mention a little bit about social vulnerability. So we had talked about that concept at the beginning, really just measuring kind of what is the resilience of a community. What you're looking at on this map here is a county level measure of social vulnerability that looks at about 15 different measures collected by the Census Bureau. So we kind of grouped counties into 3 groups: low, medium, or high social vulnerability. The darker the blue here, the higher the social vulnerability score. And when we look at how social vulnerability is associated with other measures of chronic conditions here, we see a lot of pretty interesting patterns. So basically across the board, places with higher social vulnerability have higher obesity, diabetes, and blood pressure rates across our state. Race and ethnicity, I think, is probably one of the more challenging disparities to talk about. And so just always try and preface some of these data with fruit and vegetable consumption and things like participation and physical activity. The disparities that we see by racial and ethnic group, we know are very, very connected to inequitable access to healthy, affordable food, safe places to exercise, and that these inequities have really, really long and unresolved historical roots. So with those things in mind, we do see that Alaskan, Native American Indian, non-Hispanic, Black, and Hispanic adults in Wisconsin are consuming fruits and vegetables at lower rates. They're also consuming lower fruits and vegetables, higher daily sugar sweetened beverages, and they participate in activity, physical activity less. So these are really populations in the future that we're hoping a lot of chronic disease prevention and management programs can focus on reaching. Age is probably something a lot of people who work with WIHA are very familiar with in your programming. Just suffice it to say, we all kind of know chronic conditions become much more common as we age together gracefully. But many conditions we normally don't see until older ages are happening much earlier in life. And this is particularly true with obesity and type 2 diabetes. So some of the same concepts here, we're looking at older adults that are less likely to drink daily sugar sweetened beverages, which is awesome. But when we start to look at some of the other measures, we're seeing obesity rates peak at middle age. And then we also see 1 in 5 adults in Wisconsin over 65 has diabetes, and that's significant. I mean, it looks very similar to the rest of the nation, but just feel like that's an important point for this group to really drive home. And then sort of the final section here, we do know that rates of chronic conditions vary by sex. Some of the highlights here, males in Wisconsin report consuming fruits and vegetables less than women. And then sugar sweetened beverages, they are consuming at higher rates. And then men are more likely to have prediabetes, diabetes, high blood pressure, and high cholesterol, all the big conditions that we're focused on. Some of the disparities for females, we know that they participate in physical activity less on average. And then one thing I really wanted to highlight, that females make up currently about 76, so about 3/4 of National Diabetes Prevention Program participants in Wisconsin. I think this is something we're really trying to focus on in the future is recruiting more males in enrollment for this program. So just wanted to maybe drive that point home too for this group. I think that is it for me. So I'm gonna pass it back over to Chris. I'll drop my email in the chat before I have to hop off here, and then our link to our website. But yeah, just appreciate the opportunity to connect with you all on some of the data and trends.
Thank you, Lena. So much there. There's so much in your presentation. So it's really sort of fascinating, I think reinforcing in some ways some of what we imagine to be true. Good to have the data that supports that. But very interesting, particularly as we talk about diabetes and other chronic conditions, to see how health behaviors and specifically like what we eat and the physical activity that we get have an impact on our, risk for and incidence of chronic conditions. So again, thank you so much. Does anybody have any quick questions for Lena? I know she does have to hop off. All right, well, I'll let people think about that a little bit. Again, thanks, Lena. And if questions pop up, I'll get in touch. All right. So moving forward, wanted to talk a little bit in light of, what we're learning from the data and the information. Just wanted to briefly talk a little bit about the programs that were referenced there, the National Diabetes Prevention Program, of course, the Healthy Living with Diabetes, and the Diabetes Clinical Intervention, or DSMES. I just want to go through that somewhat quickly. I think some of these statistics will match up to what you heard from Lena about 1 in 10 people in the US has diabetes. 1 in 3 Americans has pre-diabetes. So 8 in 10 do not know that they have it. In Wisconsin, that's 1.5 million adults who are pre-diabetic. I think a really interesting and important statistic is related to COVID-19. 40% of Americans who died from COVID had either type 1 or type 2 diabetes. And that's again significant. We knew chronic conditions were a risk factor when it came to bad outcomes with COVID-19, but 40% of folks who did pass away from COVID had type 1 or type 2 diabetes. So that's important to know and understand, and I think gives a little more context to the importance of the work we do in supporting people with diabetes. Having diabetes more than doubles a person's average annual medical costs as well. I don't need to go through this much because Lena really did talk about this, but when it comes to diabetes, clearly there are disparities in tribal communities. Folks are 3 times more likely than non-Hispanic white populations to have diabetes, 2 times more likely in African-American communities, and 2 times more likely as white populations in Hispanic communities. So disparities clearly exist, as Lena mentioned. So I'm just going to fairly quickly go through just so you have a better idea about these 3 different programs and what their focus is. I just want you to be aware of them. Certainly WIHA offers the Healthy Living with Diabetes program, but we also support and encourage folks to access the program that best matches their needs or their what they're able to do in terms of time commitments and things like that. The National Diabetes Prevention Program, introduced by the Centers of Disease Control and Prevention. So it's a CDC program, and it's for people with prediabetes or who are at a high risk of developing diabetes. So people who with prediabetes who take part in the program reduce their risk of developing type 2 by 58%, and in older adults, they reduce their risk by 71%. So it has really good outcomes. Just briefly, this is a year-long program. There's 16 one-hour weekly classes, 6 to 8 one-hour biweekly or monthly classes that follow that, but the program takes the whole year, and that has to do with the behavior change component as part of the program. It's delivered in a group setting available in both English and Spanish, and facilitated by a trained lifestyle coach. It's also a program that can be done virtually. Oops, a little quick. Healthy Living with Diabetes, or some of you think of it as the CDSME program developed by Dr. Kate Lorig at Stanford University, is evidence-based for people with type 2 diabetes. People with prediabetes can take the program and benefit from the program, but it's evidence-based for folks with type 2 diabetes. 53% reduction in average emergency department visits in the first 6 months following the interventions, and improvements in A1Cs are the benefits of the program. And it's also been shown that the total average annual healthcare costs that are averted, that is ED and hospital visits per participant, is $816 based on the research. So this program is also available, as many of you know, Vivir Saludable con Diabetes. That's the Spanish language name for it. And it is a 6-week, once a week intervention. So you once a week for 6 weeks and you're through it. Delivered in a group workshop setting. 2 trained program leaders instead of 1 lifestyle coach. That's one difference. Also available in English and Spanish. And as of the pandemic, we are able to deliver this program virtually as well. Lastly, about the Diabetes Self-Management Education and Supports, or DSMES, you'll hear that tossed around. This program is based on national standards for diabetes care and evidence-based for people with diabetes. So anybody with any form of diabetes has been shown to reduce emergency department visits and hospital admissions and readmissions, reduces all-cause mortality, and improves A1C levels. So a lot of the outcomes, the benefits of these programs are similar to each other. It just, again, is an issue of which of these programs best matches up with an individual who presents with diabetes in your area, in your community. Similarly, this program is available in multiple languages. It's different and it can be delivered in both an individual or a group setting. So it's a little bit more flexible in those terms. It's delivered by a trained diabetes educator, and oftentimes this is in a more clinical setting, not always. And the intervention is based on an individual assessment. So it's more personalized in a sense to the individual and their needs. This is also a program that can be delivered virtually. So just wanted to give you like a really quick overview of what each of those programs is, and then direct you to our website where you can refer folks for one of these programs. So we have on our website a referral button that even though we've updated our website, remains a referral spot where you can click right on the homepage at wihealthyaging.org, and you will see the WIHA Health Promotion Program referral form. It's an online form that you can fill out. We have edited this so that it's much less information that's being requested. So you can see here, this is it. This is the whole form where we're asking information about the person you're referring, and that could be you, or that could be a family member, or that could be a patient. We ask information also about the referring organization or the person, just so we have some record, and if we need to go back and ask questions or circle back in any way, we know where the referral came from. And then here you're able to select the programs, and you can refer into any WIHA programs, but also into the National Diabetes Prevention Program and into a DSMES intervention as well. So it's a much shorter referral form, and I think that's going to make it simpler. Here you can see it up a little more closely of the kind of information that we're asking. But it's quite simple, and there's not a lot of required information in it. So we hope that, having heard a little bit more about diabetes, that you'll think about whether or not you're able to do some referrals into one of these programs as you're encountering folks, or that you may have an interest in becoming a program provider yourself for either the National Diabetes Prevention Program or the Healthy Living with Diabetes program that we offer. We have created a flyer as well that we will be sending out in the WIHA update that helps you, for folks, particularly if you're in INA or any other, depending on your organization, obviously, but this gives you a little bit more information about each of those programs and directs you to find the referral button at WIHA. So this document will be available. You can download it and post it at your desk or workstation, or share it with others in your organization as a means of being able to refer folks into one of these programs in your community or virtually. So again, if you're interested in becoming a provider of or refer to a diabetes program or support, you can contact Amy Ryan, who's our new chronic disease prevention programs coordinator, and her contact information is right here. And if you have other questions about any of the chronic disease programs, Amy or Jill Rankin, our program implementation director, can help you with that as well. And speaking of Amy, I'm going to turn this over to her right now to talk about a little bit of activity going on with Healthy Living with Diabetes.
Thanks, Chris. Well, hello, welcome. Nice to see so many wonderful faces and names that I recognize on the screen today. So I wanted to talk a little bit about the Healthy Living with Diabetes and that 7th session, or the bonus session. And that really is linking a lot of what Chris and Lena talked about today together, and how can we tie that in with our Healthy Living with Diabetes workshops that we're having. So last fall, WIHA sent out a survey to program providers, and I just want to give you some of the results from that survey on the program providers that offered a 7th session or a bonus session for the Healthy Living with Diabetes workshop. So as you can see, 88% of the program providers who offered that or offered that 7th session or bonus session in their last session. And 100% of those program providers found that to be beneficial to the participants in their Healthy Living with Diabetes workshop. 80% of those workshops were able to find a guest expert, sometimes having to do with the Diabetes Self-Management Education Support Program. They would have one of those folks, dietitians or nurse, come to the program and talk a little bit about those other programs that are out there for folks that are dealing with diabetes so that they could continue their education. Some of the things that we did find is from the participants, they felt it was just better to stay for another hour after that 6th session instead of coming the next week to a 7th session. And just the travel time was better for them. One of the barriers that they were really running into is getting participants to ask questions. And then even scheduling the time with the guest expert. So that's something that we want to work on here at WIHA, and how can we better help you as program providers and facilitators to really offer that 7th session so that folks can continue that education. So that's the survey. And with that, I think, Chris, I've got another slide here. So this is a little challenge, and I know that Jill had put this out last fall, but we are continuing it. So just so you know, any of the workshops that are scheduled from September 22nd through March 23rd that offer a bonus 7th session, you're going to be put into a drawing for a free leader voucher for 2023. So we all love free things and are excited about that. And I did see on the WIHA site, there were quite a few Healthy Living with Diabetes workshops already scheduled. So yay to you who have scheduled it. If you haven't gotten those forms into us about upcoming workshops, the sooner the better. We would love to see that. And then I will be drawing for the winner of the free leader training on May 1st. So if you have a Healthy Living with Diabetes workshop planned this spring, make sure you get your data back in to Ella as soon as those workshops are done so that we can get your name in for the drawing. That's all I got, Chris. If anybody has questions, feel free to email me or call me.
Great, thanks, Amy. All right, I'm just checking the chat. I don't see any questions, so, but you know where to go if you have one. And again, feel free to pop anything in the chat. Now we're going to move on to talk more about the Falls Free Wisconsin Center. This, for those of you who've been attending office hours, this is not new. Although every time we meet now this year, we'll be updating you as to where we are with the Falls Free Wisconsin Center. This is an exciting opportunity that WIHA has to create a space and to create collaboration around falls prevention. So we're enthusiastic. I think I've mentioned in the past, this is a opportunity that came to us via federal earmark funds that we're dedicated to supporting Wisconsin and creating this Falls Free Center that will reach individuals, their families, their caregivers, and professionals and communities around the state to reduce falls in Wisconsin. So some of this is new, and some of this is just reminders or reinforcement for you. But you all maybe recall that we did a barriers survey in 2022 to better understand the barriers to participation in evidence-based programming. But one of the questions we asked people was, which of the following is a concern for them as they get older? And I think it's really revealing to see at the bottom that the thing that got the most votes, and they could check all that applies, so they might have checked every one of them, some of these folks, but the thing that they were most concerned was preventing falls. So that's I think, again, a big indicator to us that falls prevention has a couple of things going for it in terms of raising awareness with folks. One, people kind of understand falls prevention, or that falls are a problem. It's not super challenging to get people to recognize the seriousness of older adult falls. So that's one really important factor, I think. And as we move this forward, that raising awareness of falls doesn't require us to necessarily educate people to what a fall is. Most people have a pretty good idea of what falls are. And it's a little different than some of the other things we work on, where people don't have the same level of awareness of what the actual problem is. Getting people to understand falls has become a little bit easier, because they do see people in their families and in their communities. They know what a fall looks like, and they know how serious it can be. The other thing that's really important, there's a lot of data around falls. It's important, and we're the state with the highest death rate due to falls in the whole country. This piece of information, I think, is very revealing as well. Where do falls happen? And by a wide margin, falls are happening in private residences. So in and around the homes of the people who are doing the falling. So it's another indicator to us of where we should be thinking about putting some emphasis. If falls are happening in the home, what are the kinds of supports that we can create, and information and resources we can provide to help families, individuals, caregivers reduce falls in the home. So what is the Falls Free Wisconsin Center going to be? So for consumers, families, and their caregivers, we're going to develop what is a super positive, upbeat, you can do it, virtual space that they can come to, utilizing their desktop computer, laptop computers, iPads. Not all of the features will be available on phones, because some of them require a little bit more real estate to be meaningful, but there will be interactive features. And I think the key also is in that we're going to make sure that not only are we providing tools and resources, but we're hoping to provide the kind of motivation that will get people interested in taking steps to reduce their falls risk. So that's going to be, when people think of the center, they've asked, oh, is this like a building, or is this what is this exactly? And it is a virtual space, a website where people can come and find falls information and get the motivation they need to be able to make the changes that will reduce their falls risk. That's piece one. Piece two, within that Falls Free Center, there's going to be a variety of resources. First, there'll be a consumer guide for preventing falls, and that's going to have multiple sections. We know there are many factors that can influence a fall. Medications can have an influence, your footwear can have an influence, your home hazards, your balance and strength. There's all kinds of factors that can influence a fall. So we're going to put together a guide that will very clearly and easy, simple to follow instructions and language, share out all of that information so that people can use that along with a planning tool to create safer environments for themselves. So those resources, and we know a lot of those resources exist already. So part of what we're doing is curating like the best ideas and providing the content in a way that's easily usable for consumers and their families and caregivers. Next, we are going to, and this is a bit different than anything we've seen elsewhere specifically, and that is a virtual home walkthrough, identifying like in-home hazards and showing ways to eliminate them. So it's not going to look like this, but I'm showing you this to give you like a sort of sense of how we're going about developing this. So this is going to be a virtual tour where you're going to be able to move through a space, hover over potential falls hazards, like here, ooh, we see a broken chair, definitely a falls hazard. When you get to that spot, a pop-up will come up and identify the falls hazard and what you can do about it. And it'll tell you at the top, like how many hazards there are in this room for you to find. As you cursor over things and find one, it will highlight for you, and you'll get the pop-up that explains what that hazard is and how you can eliminate the hazard. And I'm just going to quickly, I think, click in here and show you how we think this is going to navigate. Please tell me if you're not, someone give me the sign if you're not seeing the screen moving. Are we there?
We only see the PowerPoint slide.
Oh, shoot. That's too bad. You should see the whole thing. All right, well, you're gonna have to take my word for it. Oh, darn it. Hold on a sec. I can sort of describe this to you so you can kind of visualize it. It is a, if you've ever gone house hunting and gone on Zillow or one of those websites and clicked on a home, you can often see a 3D tour of the house. So basically there are circles that allow you to move through the space. So it's a real live space that you're looking at, not a cartoony kind of space or a gamified space. It's a real live space that you're moving through. And as you enter each room, you're going to have something that identifies that there are X number of falls hazards there. From there, you'll be able to, oh goodness. Are you still seeing my screen?
Yes.
Sorry, I'm gonna have to reshare. Right, where is it? There we go. All right, you're seeing my screen again. Sorry, I got a little lost there for a second.
Yep.
Great, thank you. So you're going to be able to move through what looks like a real space, not a cartoon environment, and be able to identify these falls hazards. Sorry, I couldn't show it to you because I think it's kind of cool, but I think many of you probably know what I'm talking about or have done those 3D tours of homes where you can walk through and take a look at it. So we're actively working on that, and we're kind of excited about what that's going to look like once we have it produced. The idea is that we'll have a single family home and also an apartment setting. So we'll have 2 of these virtual home walkthroughs to use. Once a consumer or their family does the whole tour, walks all the way through, we will ask them for their county and then a list of resources and information in that county will be available. When we launch this initially, we may not have all the counties built out because obviously we're going to have to work with, the aging offices and ADRCs and counties to get all the information that we need there. But in the long run, the hope is that we'll have information by county that will direct people to folks who can help them find the kind of resources, if they need a grab bar, for example, or if they just need someone to help them identify their own home hazards or get rid of things or whatever, that will be able to direct them to those spaces to be able to get the kind of support they need to reduce their falls risk. So we're excited about that. It's moving forward. It's going to take a lot of work, we know, but I think at the end, we haven't seen anything exactly like this. And so we think it's going to be something that will be a benefit to folks and communities around the state. Also, part of the center is we're going to have some interactive quizzes and games to teach falls prevention strategies. So we already have some of those things developed, but we're going to be working on additional ones. I think we know that what's going to be so important to make this feel motivational and interactive is that we have tools and resources that people can use and do something with. We also know relatable stories, both, text, images and text and video are also going to be important to have as part of the site. So we're going to be reaching out to folks and we'll have an ask of all of you to help us develop some of those relatable stories. And then access to obviously our evidence-based falls programs, as we do on our website now, we're going to have find a workshop features that'll allow people to find local falls prevention programming in their area. I think the other really, really important part of this is that we will have resources to do a fairly robust promotion plan to make sure people know about and are motivated to visit the center. I think a lot of times we get resources, we get excited to build something, but it's only as good as the hands of the people into which it lands, right? So unless we are able to raise awareness of this through an advertising campaign, doing a mix of other like paid social and online advertising. We've been talking about possibly engaging social media influencers to drive people. So we're really trying to be open and think a little bit outside the box of our sort of more traditional means of promoting things. And we have some resources, financial resources to be able to do it. So that's a huge part of this, is that we need to really raise awareness of the tools and get people come into the site to take advantage of them. We'll also be doing a media tour in the summer of 2023, some of which will be around in communities where some of the LEAF projects are going on. And with that, I'm gonna ask folks for who are part of the LEAF program to hop on and say a couple of words about their project. I know several of you are on with us today, so maybe I'll just call on you quickly. For those of you who don't know, the LEAF grant project was a funding that WIHA was able to extend to 10 different organizations. Here, I'm jumping ahead. We got 30 applications for this funding, and we were looking for some creativity and good ideas of ways that a community could, work on a project or have an event or come up with some kind of initiative that would reduce falls in the community and be a launch pad for further activity around falls prevention beyond the end of the grant project. So as I said, we had 30 applications and we're able to award 10 projects with funding. So I know a few of you are on. I'm going to call on a couple of you to just hop on and talk about your project. Brittany Borchard from ADRC of Dodge County. Are you here, Brittany?
I am.
Hi.
Hi.
Tell us
So-
about your project.
Sure. So, like Chris said, I am with the ADRC of Dodge County, and our project, we are going to use our funding to expand or implement, I guess, kind of rejuvenate a strong bodies program in our area. So primarily our funds are going to be used for equipment and advertisement and getting that program up and running and offered to the community.
Well, and right, and as we heard from Lena, physical activity levels are could certainly be higher, and we know that has an impact on falls when it comes to people's strength and balance. So, so great, thank you, Brittany. How about you, Ashley Hillman?
Hi, everyone. So I'm Ashley Hillman and I am with Safe Communities in Madison. So we're serving Dane County. And our LEAF project is building the infrastructure and capacity for a program called Activate Bailando, which is a Latin style of dance for Spanish-speaking older adults. We know in our community there's a gap in services for programming, balanced programming for our Spanish-speaking older adults. So this program will incorporate some balance assessments and also get at social isolation. And then our goal is to provide a training tool so that we can offer this workshop or this class in multiple areas of the county and just for sustainability purposes. So thank you again, WIHA. We're super excited to get this up and running.
Thanks, Ashley. Great. Let's see, Carly Severson.
Hello, my name is Carly, and I'm an injury prevention coordinator at Gunderson Health System, which is a level 2 trauma center in La Crosse, Wisconsin. And with our project, we are really focusing on expanding our capacity for evidence-based falls prevention programs. So we are focusing on expanding facilitators for the program Bingo Size, which is combines bingo, exercise, and falls education. So we have partnered with 9 facilities, including some assisted living, nursing homes, and adult daycare centers. And they are going to have 15 staff members total become certified facilitators with the Bingo Size program, with the agreement that each of them has to host at least one program a year for the next 2 years with the funding.
Great, thank you. Megan McCormick, are you with us?
Yeah, I'm here, Chris.
Hi.
Hi, so we're gonna use the LEAF grant for also going to run with Bingo Size, the evidence-based program. We had partnered with our local interfaith volunteers, and we're going to have myself, our DCS is going to be using that training to take that for the 10 for Youth, which is an adult day program, over there to the interfaith building. And then we're also partnering with our community youth center and having one of them be trained as well. Our goal is to kind of get along with the social isolation, just keep people moving. We did a bingo bash earlier or late last year and got a lot of response from our elder community members that kind of wanted to keep forth going with bingo. So the LEAF grant's going to help us and introduce Bingo Size both in person and virtually if people are needing that as well.
Great, thanks. And lastly, Dana Lawson in Portage County.
Hi, thanks for having me. And then also awarding us the funding that allows us to address falls in Portage County. We're really excited about it as well. So this year we have many little projects that we hope will have big impacts down the line. So one of the things that we were going to be doing here is increasing our attendance at our annual Falls Prevention Resource Fair. So we're going to be securing a larger event venue to offer more screenings, activities, and vendors, offering food, which we haven't been able to offer in the past, offering transportation options such as shuttle buses to rural and low-income areas, and then utilizing 60 students to offer screening and orientation at the event as well, purchasing some small incentives, and then investing in more marketing supplies. And then another component to our plan is to increase our capacity to offer stepping on and other falls prevention activities in Portage County. One of the things that we'll be doing to make that happen is purchasing an additional stepping on kit and then recruiting 2 stepping on facilitators that are willing to travel around the county. And then lastly, which is kind of like the backbone of the whole plan, is we're going to be working to grow and revitalize our coalition. So to do that, we're going to be developing screening and referral systems, not just into the ADRC programs, but also into partner programs and services as well, to kind of create more of a coordinated approach and incentivize participation between coalition members. And then we are also going to be investing in branding and marketing just to gain more familiarity and recognition throughout the county. And then inviting new partners in from diverse backgrounds to maximize our perspectives and reach. And then lastly, we'll be meeting more frequently to strengthen and nurture the partnerships that we already have and the new ones, and then just accomplish more together. So yeah, that's pretty much summarizes our plan. It's a lot, but we're really excited. So
Yeah, as are all these projects ambitious. And I will say, the 30 applications came in and there were 30 winners. Like, they were all great. There was not, it was such a challenge with the limited resources we had. So appreciate everyone who applied for the funding, and to those who didn't get the funding this time, we would love at some point to be able to do this again as an opportunity arises, because really, we recognize a lot of where falls prevention happens is in the local communities. And we're going to be looking to all of these projects to try to identify some best practices that can be shared out as part of the center, and even be able to reach out to folks to help us provide technical assistance to others who want to replicate really good ideas. So thanks to this is 5 of the 10 that you just heard from. We'll be inviting the other 5 to come along next time, so you can hear a little bit more about some of the projects. But over the course of this coming year, you'll be definitely hearing more as these projects get underway and completed as part of the term of the grant. So thanks all for sharing what you're doing. So our ask of you, we do have several things that we're hoping that you can help us with. One is that we are looking for fall stories. So we want to talk to folks who have either had a fall and have a compelling story to tell about that fall. People who maybe had a fall, were at risk of a fall, and took an evidence-based program that helped them gain their confidence so they feel much less at risk of a fall. Any kind of, even from family members who had a concern about a fall, but we're really looking to develop a package both for the center and for the virtual space. But also, as we're going around talking about falls prevention around the state, we want to have lots of different stories to tell from lots of different communities and lots of different cultural backgrounds and other things, where we can really put a face on falls in Wisconsin in communities all over. So asking you to think about that, and Susan Schreiner, who is our falls prevention program coordinator, who's not able to be with us today, but we'll be reaching out with more frequency to try to find folks in your communities that we can talk to and create stories around. And we're willing to, obviously, if you can help us identify people, we're willing to contact them with their permission and do the interviews and things. So that's one ask. Help us find really impactful stories around falls. Next, we're going to be holding focus groups to help us as we put together some of these components to get some feedback from both consumers and professionals that can give us feedback on what the site looks like, how it navigates, what the content is, and how is that meaningful to them, how might they use it. So we're going to be probably over the next several months into the spring, we're going to be putting the content together and then wanting to pull together multiple focus groups of people. And again, we're looking for like a diverse bunch of folks to give us feedback on the contents, but also when we talk with professionals, how might you use this content? Like, how can we package it in such a way that will be very usable to you? We'll be talking also, with our partners here. Obviously, the program providers are so close to this, but also to partners in public health and public safety, EMS folks, who are sometimes looking for resources to be able to give to folks who, when they have a fall. We're also going to be wanting to feature and curate some best practices for systems that can support people who fall or fall frequently. We know many of those are existing already in the state. We want to be a repository for some of those best practices, so we can share that with communities who want to create that kind of system that leads people who are falling frequently to the kind of resources that will support them. And lastly, not leastly, and we've talked about this, I know, before on these calls too, so I'm always aware, I don't want to tell you this about 1,000 times, so you're like, okay, that's enough of that. But we're the convener of the Falls Free Wisconsin Coalition. It is a partner to the Falls Free Wisconsin Center. The coalition is made up of individuals and organizations with an interest in falls prevention, ranging from folks in community-based organizations, ADRCs, Aging Network, also public safety, healthcare, and others. And we come together to try to come up with strategies for falls prevention from a statewide perspective. So how do we help local falls prevention coalitions not need to reinvent the wheel? How can we create some of those tools and resources as a coalition and share them out with local coalitions, which are already existing, help new coalitions to form? So we invite organizations to join the Falls Free Wisconsin Coalition as a means of staying kind of up to date on what's going on in falls prevention, and to connect to initiatives as they happen. So, as something is developed, a good example is Falls Prevention Awareness Month. Lots of resources are developed there. And there could be a coordinated state public awareness campaign. So, by joining the Falls Free Wisconsin Coalition as an organizational member, we would just ask that organization to provide a contact name for us that we can communicate back and forth with. And you will be seeing more information about this. I think if it's not up on our website yet, it will be very shortly. The link to the online form where you can register to become an organizational member. So those are the three things we're asking. And you'll be hearing more about this, of course, as time goes on. But if you think of things, or if you're willing to be part of a focus group or help us convene consumers for a focus group, if you want to pop that in the chat, we will follow up with you on that when the time comes. So with that, I'll stop unless there are any other questions. And don't worry, you'll be hearing about this. You'll be hearing about this regularly, because we are really all hands on deck in terms of creating this new space and new resources.
Looks like Amanda put something in the chat. There's AARP has a home walkthrough maybe, so we can look into that too.
Yeah, we did think I'm trying to copy that. We did think we did a scan of the likely sources, but I'll take a look at that. Thanks. Thank you, Amanda. Great. All right. Next on the agenda is WIHA program updates. And for that, I'll turn it over to Jill.
All right. Thank you, Chris, and everybody. Great information today. What I was just going to do is a brief overview of some reminders, some changes, actually. So on the WIHA website, I'm going to share my screen. Maybe. Okay. Bear with me for a second. Okay. So on our lovely new website here, as most of you are aware, when you go to the For Professionals section of the website, which is where you are most often, and you go to Program Resources, so after you've logged in, this is where the bulk of a lot of our things are, obviously, for our support materials for you. I want to point out the program requirements right here, which I'm just going to pull up here for you really quick. And this is a working document, so anytime that there's changes to this, we will obviously let you know in either a WIHA updates or during one of these office hours. And that's what I'm going to do today. But this document is just going to kind of be your go-to when it comes to leader and facilitator requirements, in-person participant versus virtual, and all those kinds of things, what the requirements are for leaders and facilitators to be able to lead these programs effectively. So as you know, part of our job at WIHA is to monitor quality assurance. And all of these program requirements are due to that requirement of us to monitor fidelity and quality assurance for everybody. So when it comes to, leaders, facilitators needing to lead at least one workshop per year, things like that, that's why all of this is on here for you. Because when that does not happen, according to research, thorough research that's been done nationally, worldwide, and even here in Wisconsin. All of these recommendations or requirements are based on that research. And because we know that when these requirements are not adhered to, then fidelity of the program does decrease, which means we can't say that they're, going to be getting the participants are going to be getting the health benefits of the program. So with that fun little intro said, we have some good news for you, that we have just simplified this a little bit for everybody based on our current research. So almost all of the WIHA programs, there is a requirement that a leader must lead and facilitate at least one workshop per 12-month period. When it comes to, I'm just going to do a quick overview of the clarifications that we've seen needed over technical assistance questions we've gotten lately. And that is with the CDSME programs, which are your chronic disease self-management education programs. So the diabetes, the chronic pain, and the chronic conditions. That one, if somebody is trained in multiple programs of those, so let's say somebody's trained in 3 of those programs. They're trained in, let's say, chronic pain, chronic conditions, and diabetes. They only do need to facilitate 1 workshop per year. However, you can't go more than 2 years without facilitating the curriculums, every curriculum that you're trained in. So if 1 year you do chronic pain, the next year you do diabetes, you'll need to also do chronic conditions then too. You wouldn't be able to go just do chronic pain 1 year, diabetes 1 year, and chronic conditions 1 year. You have to make sure that you're not going more than 2 years for each curriculum. So while you only need to do 1 of those to stay active, we just need to make sure that you're active in all of the programs. Otherwise, then your facilitation will lapse. So that is just kind of a little nuance with those programs. I also want to point you out to Mind Over Matter, which is our incontinence program. We did have a recommendation that leaders or facilitators do at least 1 workshop, or I'm sorry, 2 workshops per 12-month period, at least in the first year that they are trained. That is still a recommendation, but in working with the program developer at the stage that we are in with implementation of the program here in Wisconsin and nationwide, we are now comfortable saying that it's only required to do 1 workshop per 12-month period for the Mind Over Matter program. That's good news. We like to be able to provide that good news to you all. And as you can see, every other program most of them are 1 workshop per 12-month period, with the exception of Powerful Tools for Caregivers, which is the 2-year requirement. So just wanted to point that out to you all. And then of course, you've got your participant numbers and questions in here as far as how many, what's your minimum and what's your maximum, depending on which format you're using. Another thing, just a quick note is, so for most of the WIHA programs, you have Mind Over Matter, PALS, Stand Up and Move More, Stepping On. Those programs are WIHA administered programs, meaning we are the national program administrator purveyor for those programs. So we work with our program developers to develop these requirements. Those we have a little bit more control over, but the research that we have on those is very similar to the ones, for example, like the CDSME programs, which are sponsored by a national office that's not at WIHA, but then we are the statewide administrators of that program, those programs. So there are some differences in the national ownership of some of these programs. I will just say that for the CDSME programs, the ones that we don't have national ownership of, but we have a statewide license for, the program fidelity and quality assurance for those program requirements are getting a lot more, not strict in the sense that they're changing the requirements, but now our reporting requirements at WIHA, we have to submit a yearly report for these programs and how many facilitators we have, how many leader trainings we've done, how many participants we've had, all of that kind of stuff. That's getting a lot more detailed. So when we have, if there are a lot of workshops where we are not meeting that minimum participant level, so let's say you have a lot of workshops that only have 5 participants in them or 4 or something like that,
then our national numbers look very skewed. Because we'll say, for example, let's say we did 10 workshops, but we only had 15 participants. Then they will come back and they'll ask us for more data and things like that. So that is putting our statewide license in jeopardy. So that's one overview thing I just wanted to make sure that everybody was aware of. That's one reason why we're kind of reaching out to people when we notice that there are low numbers in your workshop, low participant numbers. We totally understand the challenges with that and want to help you out as best we can. We want to make sure that we're able to keep our license requirements adhered to. So hopefully that's a really fast, boring, technical overview of why we monitor quality assurance and how we do that. But hopefully you can all get a better understanding of the reasons why we have to have those requirements and why we are so excited to be able to help you out when you need brainstorming as far as, you know, I need more participants, what are some other ideas, and even working with you to make sure that we have your leaders, your facilitators up to date on their certifications, because we definitely want to do what we can to be able to do that. We have some workarounds that we can do, so please always be in communication with us when it comes to those challenges. And hopefully we can turn that into a positive, and we have lots of successes under our belt. We definitely appreciate all that collaboration, so thank you so much. And then the kind of exciting little update I have also before we get to a quick data collection update is our leader trainings that are scheduled for 2023. We have increased Stepping On. So we have another Stepping On leader training on our website, so check that out. We have an in-person one coming up in May, but we also have a February one. And we do actually have like 1 or 2 spots, not a lot, but 1 or 2 spots available in our February 22nd leader facilitator training. I keep saying leader, and we keep trying to switch it to facilitator in our facilitator training. And that one's an online training starting on February 22nd. So if you do need someone trained in Stepping On in the next couple months, please get your registration in. It's officially closing tomorrow, so get it in by tomorrow. And then as far as the other leader trainings coming up, we do have one coming up on February 8th for living well with chronic conditions. And that technically has closed, but we also have a little bit of extra materials for that this time around. So if you do have somebody that needs to get into that training, then registration will also close tomorrow as well. So you can sneak someone in if you need any last minute living well trainees. So that's all I'm going to say about leader trainings. I feel like I've talked really fast, but I'm going to hand it over to Erin, and she's going to give us a data collection update.
Hello, everyone. So just a quick update about data collection. So as a reminder, all program providers are required to do data collection under the WIHA license, and you can access all of the data collection materials on the website under For Professionals and then Program Resources, and there's individual packets per program. I did just update all of the program packets. So I think this past year we've been doing it where we had one main page and then a separate pre and post survey that were program specific. And there was a few problems with that and making sure that we're getting everything back. So we went back to how we had it before, and it's one packet per program. So you'll just print off the packet for stand up or Stepping On or whatever the program is, one packet per person, and then distribute those, making sure that you're checking for completion and then returning those to WIHA within 2 weeks of the last workshop date. So just a reminder that you should always check the website for the most updated materials, and those are all freshly updated as of today. So if you have a workshop starting like next week and you've already printed off materials, don't worry about that. But if you haven't printed materials yet or you don't have a workshop starting immediately, make sure that you're going to the website for the most updated materials. If you have any questions about data collection or anything, you can always feel free to reach out to me or Ella as well.
I just sent something in the chat about data, and I'm just wondering how I can get some of our program data to show the effectiveness. You know, I
Yeah, so most
have
of,
lots of, oh, I love the class and this, I need,
yeah. So Lisa, most of our program surveys don't collect that type of data any longer, simply because they're past the research phases. So there are some programs like we're very involved in the Stand Up and Move More program, and that program did collect more information as of last year because we were still going through that evaluation phase. So if the program was going through the evaluation part, then we would be able to pull the data, but a lot of the programs aren't going through that evaluation, so we don't pull that kind of data. So it would just depend on which program it was and where we're entering that data. So it's basically a one-on-one conversation to kind of investigate that. Just so everyone knows, in the future, we are working towards a new type of portal where you will have access to those surveys and such. So you would be able to run your own report at that time. So we are working towards that, but we're still a ways off from that, from getting you guys on that portal.
Great. Someone had asked about how to join the Falls Coalition. I put the link to the form there so you can take a look, and we hope bunches of you will join us as part of the coalition. Are there any other updates, Jill, or?
I don't think so. Lots of great questions coming in through the chat. So feel free to email us, email any of us here at WIHA. We're happy to help you out. If you can't locate something on the awesome new website, we can walk you through that. Basically, everything's on there. It's just a matter of getting used to the new format. And thank you, Erin, for putting all that together for us. We're really excited about it.
Mm-hmm. Yeah. One other quick reminder. The fact that you're here means you got the calendar invitation and it landed, most of you anyway, it landed on your calendar. For those of you, we know there are folks who, for whether they're server blocks or emails or whatever, that aren't getting some of the information. If you are not getting, like within a day or two, typically we will send the WIHA update newsletter as a way of recapping this meeting and sharing the recording for folks who weren't able to attend. If you're not getting the WIHA update newsletter, if you could do a quick search of your junk or spam folder to see if it's landing in there, and then be sure you whitelist us or enable, or if you need to talk to your IT, or I know it's different sort of in every spot as to how you can enable us, but to make sure that you can get that in your inbox. Because we will be providing some other resources here that we've talked about and links to things. So we just want to make sure we're able to communicate with everyone, and we know that can be a challenge if it lands in your junk, because it happens a lot. And sometimes when there's a server update or something, or a security update, we can get bounced out again. So just a reminder to do that and make sure that you're getting all the stuff from WIHA. I see Lisa also had a quick question. Are there other counties offering Eat Smart, Move More, Prevent Diabetes through North Carolina State University? So your county is doing that program, Lisa, is that right? I don't know. Jill, have you heard about other?
That's going to be an Angie question, I'm guessing. Lisa, oh yes, Alyssa is offering in Barron and Rusk.
Hi, this is Angie. I will have to check my notes, but it's either Racine or Kenosha also are doing that.
Cool, thank you.
So Lisa, I can reach out to you individually.
Okay.
And let us know, Angie, because again, like we're really about making sure people know about all the different diabetes supports that are evidence-based. So if there's a lot of people doing that program, like we want to know about that as a possible program that we should include when we talk about the diabetes self-management programming. All right. If no other questions, it's 2:30 and time to say goodbye. Thank you so much all for joining us. As always, if you have questions or thoughts, run them by us. Have a great rest of your day.
Thanks, everybody.
everyone.